Hi, everybody. Will Alexander from Will Alexander's Dog Show Tips, brought to you by Canine Chronicle TV and ProPlan. Today we have on air is Dr. Valeria Rickard, and I'm hoping that she will set our minds at ease and talk about this virus that's going around and what we can do about it at the bigger shows. So sit back and listen to this important message. Hi, everybody. Will Alexander here from Dog Show Tips and Canine Chronicle TV. We have a special guest tonight. Is Dr. Valeria Rickard from Jovial Airedales, and also she's judging, I think you're using terriers and toys and sporting now. Is that what you judge now?
And non-sporting.
And non-sporting. Wow. It's hard to keep up. Wow. That's excellent. But Dr. Rickard I'm going to ask her about this dog flu that's going on. How are you tonight, Valeria? I know you're very busy, and I thank you so much for coming to see us. So
I'm very happy to be here. I'm happy to educate people and put some people at ease, and maybe make some people aware of some of the things that are going on.
That's
so
perfect.
Thank you for inviting me.
So this dog flu, what can you tell us from your end, from a veterinarian's end? Sorry.
Yeah, I wouldn't necessarily call it a dog flu. It's a respiratory complex. So there has been an increased number of respiratory cases, not just in the last few weeks. I want to say statistically in our hospital, at least for the last probably 3-4 months, I would classify it as this fall. There has been about maybe 30% increase of respiratory cases. And those respiratory cases, they present usually as a cough, frequently associated with the dog going to some public places or being exposed to other animals and other dogs, like dog parks, PetSmarts, sometimes dog shows, sometimes training, boarding facilities. And they present with usually very dry, goose honking type of cough. Some people reported that it progresses to bad pneumonias. In my hands, in our hospital, we just seen the increase in those cases. I don't think we've had anybody who did not respond to treatment and needed to be hospitalized, be on IV medications, or died. I mean, there are, people ask me those questions. We haven't had that severe of a cases. It might be different from different parts of the country, because I live in a relatively affluent area where our clientele is very well vaccinated. And for the most part, animals are well protected. So just, I guess the easiest analogy, because people relate to COVID, probably the easiest, and it has nothing to do with dogs. But we always tell people that if you're immunosuppressed, or if your immune system is not working well, or you're compromised in one way or the other, you're more likely to have a much more severe version of COVID. So same applies to this respiratory complex. And I'll describe, and there are several causative agents that can cause it. But I think it affects more severely the patients that are suppressed in some way, sick in some other way, or not well vaccinated. So I guess because people lived through COVID for the last 3 years, maybe that's the simplest analogy for them to understand. So besides the way the cough is the main presenting concern, but sometimes if the cough is very severe, animal might not want to eat or drink as much, and that's when you can have some other complications because of dehydration or other things. Not many animals had huge fevers. If it is a fever, it's a very mild fever. And sometimes people actually confuse coughing with vomiting, and they come in for the initial visit and they say my dog is retching or vomiting, but it's actually due to cough, because the cough is irritating enough to where it makes them do that. So there are several possible causes for this respiratory complex, and it is a complex because it can be due to viruses, and the several viruses are flu, which is what you originally asked me about. It can also be a dog coronavirus, which is not as common, respiratory coronavirus. It can be sometimes even distemper virus, or parainfluenza, herpes virus, so a variety of viruses. But it can also be bacterium, and strep bacteria is most common. It can also be due to mycoplasma. So there are many different possible agents that can cause it. The presentation is, for the most part, pretty similar as to how the patient presents itself. So the only way to really differentiate and know the cause, or actually what when your dog is coughing, obviously the owner would want to take the dog to veterinarian. So what you can expect from your veterinary visit is that veterinarian should probably do a deep throat swab, similar to if we were to go to a doctor and we were to have a strep throat swab, and get a sample of the phlegm. That sample gets sent out for what's called respiratory PCR panel. A respiratory PCR panel, it's an amplified technology where the lab looks for the DNA particles of those different organisms. That's how they can differentiate if it's a virus or mycoplasma or bordetella. And in the last 3 months, I want to say that probably the most cases that when we send those tests, we had the most cases of mycoplasma. We did not have hardly any kennel cough, because I want to say majority of animals are pretty well vaccinated against kennel cough. We had a little bit of a flu here and there, again, had to do with the vaccination status of the animal, but more than 50% of cases were mycoplasma related. So, if on the clinical presentation the animal is very sick, then of course blood work would be indicated. If there's something that's heard in the lungs, then the radiographs would be indicated. But that's where the owner of the dog has to have a trusting relationship with a veterinarian, and a good physical examination is going to determine the course of action. But that respiratory panel is the easiest way to get an answer. And while the lab is running the test, it's not an immediate test, unfortunately. In human medicine, you can get strep throat swab done literally within an hour or two. It takes a couple days. Then you initiate the treatment, and you usually do the treatment based on what's most common at first. And frequently we use either doxycycline antibiotic or we use Bactrim antibiotic, depending on the severity of symptoms. Those antibiotics get mycoplasma and bacteria. Remember, there are really no treatments for viruses. The virus has to run its course. Right. So usually symptoms are going to last 10 to 14 days. But supportive care is important. So if the animal is dehydrated, not drinking, then fluids will be helpful. If there's any abnormalities on the blood work, if there are any secondary opportunistic infections, then antibiotics are indicated for that. You can boost up the immune system. You can use DMG supplement. That's very good for the immune system. And overall, good mineral vitamin supplement that helps with the overall well-being. Antioxidants, vitamin C, just similar to what we would take. And just provide supportive care if it's a virus, while the virus runs its course, or until you get the answers. Clavamox is another antibiotic that frequently veterinarians use. It just has really good respiratory penetration. Most of those viruses and bacteria that I described, they tend to cause more of the upper respiratory symptoms. So on the physical exam, it's the cough that's localized to the trachea, to your neck region. Not many of those agents go down into the lungs and cause pneumonia. It usually becomes as a sequela, as a complication, because the animal is either not treated, or it doesn't have a good immune system, or something else is going on concurrently, and then it becomes what's called lower airway disease, where it goes to the lungs, and then it can become quite problematic, because pneumonias are not easy to treat, and they definitely require hospitalization.
So with these big go on.
So most of those agents, they're contagious. So, and they're spread by coughing at each other, sneezing at each other, licking. So from a prevention point of view, the best is to, obviously, if you have a sick dog, please be aware that it is contagious and don't take it places. No matter how important the dog show is, if it, you got to be aware of that you will affect the life of many, many people around you if you bring a sick animal. If you have an animal that needs to go and compete and, try to avoid dog parks and other public areas beforehand, because you don't really know. Most of the time, I want to say dog show people vaccinate their animals pretty well. And that's the biggest thing that you can do as a preemptive type of strike. The American Veterinary Association actually made a statement to where, as part of the I don't want to say protection, but it's what can you do to protect your animal besides isolation or not coming in contact is you can boost the vaccines for the things that we have vaccines for. So even if you don't have, if your animal is not due, let's say for another 3 months, and you're expecting that you're going to go to an event where there will be a lot of animals coming into close contact with each other, I would suggest that you do boost your Bordetella vaccine, flu vaccine, and parainfluenza vaccine. There's actually Novivac has a they call it respiratory vaccine, and it has 3 respiratory pathogens in there. It's adenovirus, parainfluenza, and Bordetella as a nasal drops. So that will be a good vaccine too. And it's not systemic injection, so it doesn't. People are always afraid to over-vaccinate their dogs. So that specific vaccine is drops in the nose, so it provides local immunity, and it kicks in within 72 hours of administration.
Okay, so I was going to ask next. That's good. Okay, 72 hours.
Yeah, because the flu vaccinations require, if your dog already had a vaccine, you can just do a booster and it boosts up the level of antibodies in the system and you're protected, or at least if you come in contact with the flu, you will have a very mild version of it. But for other things, unfortunately, for mycoplasma, there are no vaccines. And for some of the other pathogens that I mentioned, there are no other vaccines. But that's what you can do immediately. And that vaccine is fast-acting, does not cause systemic body response. You don't need to worry about over-vaccinating or causing some side effects. It just drops in the nose and it protects that part, which is where, the first kind of line of defense.
Right. Yeah.
So, but, otherwise using common sense. Try to avoid public expense, because you don't really know who's been there. So try to walk your dog in a more open air, fresh areas. Try to avoid maybe crates close to areas where there are a lot of dogs, just basically spacing out, like the way we spaced out during COVID. Again, I'm trying to make analogies that people understand or live through the most recently. So that's kind of common sense. But if you have puppies at home, you have to really think, do you really want to take chances? And if you do take your dog to a dog show, then when you come back, isolate. Don't, at least for a couple of days, have the dog in a different area. Make sure that that dog does not bring something back to the puppies, because they're not protected. They're not vaccinated. It could be a mild illness in adults, and it could be much more severe illness in little dogs.
Right.
Also, dogs that are pushed in faces like griffs, pugs, bulldogs, they are also more susceptible to those respiratory conditions because they don't have as good of the clearance in their nasal cavities and upper airways, and they tend to snort at each other much more than other breeds. So I would just be a little bit more cautious with those, pushed in faces.
Now, as you're a judge as well, are you taking anything as a judge? Are you looking at examining dogs differently in any way, or?
Well, as a judge, we also have to understand how it's transmitted. So saliva, snorting, licking. So we go from one animal to another animal. So the best way to protect yourself is the best way to protect the animals, the dogs that are in the ring, is to wipe your hands thoroughly in between examining each dog. That's the positive side. The negative side, sometimes there's a smell associated with chemicals, and some dogs can spook. So dry your hands, I guess, wash your hands well, wipe your hands well, and then dry them well so there's less alcohol smell. But that's the only way really to protect, is allow all the exhibitors to show, except for the breeds where you can't do it, where you need to do a thumb exam, but allow, please don't be cavalier and open mouth, is just have the exhibitors show the bite and do it last. And so that way you touch the dog, maybe there's some smell of your dogs on your hands. So if you touch the head last, and then disinfect the hands in between.
Good idea. Good common sense. Well, thank you. And are you judging this weekend anywhere?
Yes, I'm very much looking forward. I am going to Orlando. And
I knew you were going to Orlando. Yeah.
Going to have a busy 4 days there. So I'm looking forward to. It's always fun. It's always great competition. Lots of animals. Happy to see some of my friends I haven't seen in a long time. So it's always exciting.
Well, thank you again. I really appreciate you coming on here and putting people's mind at ease to a degree.
Yeah.
So
vaccinate, separate, use common sense.
Perfect.
Yeah.
Sounds easy.
Yeah.
Well, thank you, Valeria. I really appreciate it.
You're very welcome.
Take care.
Take care too. Thank you.
Bye-bye.
Bye-bye.
Thank you, Doctor. That makes perfect sense. And I hope it helps people as they go on to this dog show in Florida, the big event where there's going to be a lot of people there, a lot of dogs there. And I know that's in the back of a lot of people's minds, this virus that's going around, this cold, this dog flu. So I thank you again. I really hope this helped a little bit. Take care, guys, and stay safe out there and use common sense.